Hey guys, I'm Katrina Voigt. I'm a member of the Concept Crew. This is my first semester at LSUS in the MBA program. I actually chose this class as my first class because I wanted to study a little bit more about information systems. As my day job, I'm a senior project manager for a company called Masimo, which is a healthcare company that does a lot of work in different software and technologies in hospitals.
Hello, my name is Sony Shadjan and I am the Scrum Master for the Concept Crew. I currently work for CVS Specialty Pharmacy. I am the training liaison for our department. I've currently been working with CVS for 2 years now, and I'm hoping to grow within the company and advance my career in data.
I'm Trevor. I'm a member of the Concept Crew. I have been a personal trainer for the past 12 years with managerial experience. I've also been very active in the stock market for the past 5 years. That includes day trading and other investments. I'm very excited about the MBA and this process and looking forward to the opportunities that it may bring me in the future.
Hi everyone, my name is Destiny Trahan and I'm a part of the Concept Crew. I'm originally from Lafayette, Louisiana. I just graduated from the University of Louisiana at Lafayette, studying public relations. It is my first semester in the MBA program. I've been very excited and interested just learning about information systems and how they apply to our everyday lives. And yeah, I'm an account executive at KLFY News TV 10. I've really been enjoying it and I'm excited to show you guys what we came up with.
Hi, my name is Cassidy Turpin and I am a member of the Concept Crew team. I currently serve as the Community Relations Coordinator for the Indianapolis Colts, where I am in my 3rd season full-time. I decided to enroll in the MBA program as I'm staying at home right now and working remotely, so I thought it would be a great use of this extra time on my hands to really expand my skill set and help push my career to the next level. This has been my first course and it's been an exciting past few weeks, and I just am looking forward to what's to come throughout this MBA program.
Hello, I'm Ray Vigil, part of the Concept Crew group. I'm a global corporate account manager for Nalco and Ecolab Company. So for the last 23 years, coming out of college, I've had the opportunity to take on several different roles within Nalco. I started as a sales engineer, moved my way up to a district manager, spent some time in marketing, and now I'm a global corporate account manager.
We are the Concept Crew, and we chose University Hospitals Health Systems, also referred to as UHHS, to showcase how they use information systems to become a leader in connecting care. University Hospitals originated in 1866 as a single hospital in Cleveland, Ohio. Over the next 150 years, they expanded to include 18 hospitals, 40 healthcare centers, and dozens of medical practices. They serve over 1 million individuals throughout Northeast Ohio and are the 2nd largest private sector employer. University Hospital's mission is to heal, to teach, to discover, which is also shown on the stairs leading up to University Hospital's Case Medical Center in Cleveland, Ohio. They strive to showcase their mission by providing the best health care possible and also further enhancing and developing the future of medicine. They provide a wide range of care from women's health to cancer treatments, senior care, pediatric care, the list goes on. They also focus on developing a relationship between the patient and the healthcare provider throughout every step of life. The main business process we explored throughout university hospitals is patient documentation and the use of electronic health records, also referred to as EHRs. To break it down, EHRs are documents that include individually identifiable health information. They are edited and updated by clinicians to hopefully include an all-comprehensive medical history. This is vital to high-quality healthcare. Wouldn't you want your doctor to know if you were allergic to a certain medicine or you've undergone surgical treatments in the past? We thought overall this truly can affect every single person, so we thought it would be pertinent to explore how University Hospitals uses information systems in this realm to enhance patient care. EHRs provide a multitude of benefits, but they also can pose a few risks. EHRs assist with communication between healthcare teams to ensure all caretakers are knowledgeable about a patient's medical history and their current status. It also allows a room for error, though, on the other end, as clinicians update this and enter data manually. An essential information system for UHHS is the Device ConX system, also referred to as DCX. Implemented by NantHealth, DCX is a tool that offers a solution by automatically charting data from medical devices into the patient's records. Overall, DCX reduces the amount of time of manual charting as it almost instantly uploads important medical information and data into a patient's chart. This not only reduces the amount of time needed, but it also helps take away the risk of manual data entry by clinicians. Ultimately, we chose UHHS and Device ConX as healthcare truly affects all of us, especially as we are experiencing the COVID-19 pandemic. It is important to keep this data up to date and accurate for health providers to provide the best care to patients. We also have a teammate who works closely with UHHS and DCX system, which has allowed us to easily access professionals who are able to break down and show us the ins and outs of this partnership.
Thanks, Cassidy. Nice job talking a little bit about EHHS. Hi, I'm Ray Vigil, and I'm going to talk about the business process, specifically around what business process that we're studying and any critical success factors associated with it. So when we look at the business process, we've got two specific items that we're studying. It's the EHR, also known as the electronic health record, as well as medical device integration. When we look at the hospital sector, there's so many different medical devices. Needing to understand how you take those devices and integrate them into the process and into the electronic health record. So the key aspect of electronic health record is the hospital needs clear documentation of the patient, the details. That is what hospitals view as a successful hospital visit. When we look at the EHR screenshots, you can see trends, you can see data, you can see the implementation of their processes associated with their health records. One of the other issues associated with this is the staff, the nurses, the doctors. They spend so much time entering the data, right? But also understanding what that data means. Is the data accurate? And that's where our process comes into effect with DCX, which Katrina will be discussing in the next section. One of the other aspects is, everyone's concerned about security, also medical safety. When we look at the amount of deaths associated with medical errors, there's over 251,000 deaths occurred because of medical error. That could be associated with inputting wrong information into the EHR, could be associated with medical devices not communicating properly into their system, and causing doctors to make the wrong decisions, causing the nurses to give the wrong medication. So as we delve into the critical success factors of both EHR and MDI, also known as medical device integration, the key here is they need accurate data with minimal errors. How hard is that? It is. So one of the key aspects of UHHS, they use what MDI as a critically important aspect of their business process that they can rely to make informed decisions. So one of the things is, if you look at, according to Niemeyer, the accuracy of data increases tremendously with integration. As Bresnik stated, and as I stated previously, 250,000 deaths occurred because of medical errors. And through the use of MDI, we're going to show the value, the savings, the lives that could be saved through medical device integration. One of the other critical success factors is timely charting. If we can increase the round and assessment performance of the nurses, we can achieve an extra hour per nurse per day. And when we annualize that over the life of a year, over the life of the nurses employed at UHHS, we're looking at $10 to $12 million of cost savings just associated with one extra hour, right, of time that these nurses, these doctors are spending with their patients. So what we do know is 35% of the nurse's shift is spent inputting data. Through the use of DCX, through the use of MDI, that issue will be resolved and has been noted to be resolved. So MDI is going to give you real-time information, real-time data, give you the ability to make quick, informed decisions. Those quick, informed decisions could be the difference between saving a life or causing critical errors that could ultimately cause deaths. So, one of the other issues associated with medical device integration is the ability to take all these different platforms, different technologies, different information, and bring it all into one location. And Katrina is going to spend a few minutes now kind of rolling into the how this DCS works, how it's going to integrate the hospitals. Thank you.
Hey everyone. So I'd like to start by answering the question of how DCX, the information system that we've chosen to study, supports UHHS. So DCX is a medical device integration software. It allows for different medical devices around the hospital to automatically have their data inputted into the electronic health record. So if you think of going into a hospital, you're going to be hooked up to different devices. Whether you're going into the emergency room for an emergency or you have a scheduled procedure where you're going into the operating room, you're going to be hooked up to anesthesia, to different vital sign monitors. And as you're on those machines, that data is going to tell a story about you. The trends, the information that's on there is going to really kind of reflect your health, your stance as a patient during that time. So the care providers really need to see that. They need to see the trends. They need to see what's going on. They need to make sure that they are treating you properly based on your vital sign readings. So DCX allows for that information to automatically be charted near real time. So the clinician isn't having to go through and do a normal rounds scenario where they would have to manually chart it. They can go in to do their rounds, they can check on the patients, they can spend more time with the patients knowing that information is automatically reaching the medical record for them. So if you think about the time saved aspect, clinicians are reporting that they are saving nearly 2 hours per shift from not having to document this information into their electronic health records. That's 2 extra hours that they are spending with their patients, that they are able to care for their patients and help them get better, so that way they don't have to stay in the hospital nearly as long. DCX allows for those care providers to really focus on what they need to do, is providing for the patients instead of their documentation. The information that is transmitted from the device to the medical record is always accurate. The users can rely on that information to always be there when they need it. The system's very user-friendly and it runs in the background. They don't have to worry about the loss of the information because they know that it's going to be there. It's a reliable system for them. UHHS puts their patients at the forefront of their service. That is what they are there for, is their patients. DCX allows for those patients to be cared for in a better manner. As UH is expanding their healthcare system, they're looking at expanding different facilities, or acquiring smaller competitors. DCX is able to scale with them. It is a software-based solution, so growing that server, growing that solution really isn't as much of a challenge for them. It's something that they know is there. And as they have continued to grow over the past several years, they continue to expand their Device Connect system as well.
Some lessons learned from studying DCX in University Health Hospital Systems. I'm going to discuss some problems during the implementation process. Number 1, not knowing what to expect. Like most processes when integrating new software systems, you don't really know the problems until you're ready to install it into production. One of those major problems was that UHHS realized that some of the devices were too old to perform device integration. 2. Wi-Fi signals were not strong in some areas of the hospital for the system to work properly. 3. Because of both overweight and underweight patients being cared for, the setup was different depending on the type of device they had. Okay. Now some pros of DCX. 1. It decreases the manual transcription errors and timely documentation. 2. Overall cost and time savings in general. 3. Data integrity, which is really important. 4. Allows staff to make prompt decisions on patient care with precision from timely, accurate data. Okay. DCX has streamlined data input across the entire value chain of UHHS, ultimately providing the best patient care possible. Reduction of human error, time savings, cost savings, accurate data, and precise diagnosis and treatment are vital to a patient's care and experience. DCX has also decreased the number of readmittance. I recommend DCX or like systems to be implemented in hospitals like UHHS. It allows staff to focus more on patient care and less time on documentation and data input. Not only does DCX improve the patient's care, but it also improves the employee experience by minimizing the workload to focus more on the patient. MDI, medical device integration, has a high switching cost, so I don't necessarily recommend UHHS to transfer systems. This system, DCX, is customized for their site. Switching to a competitor like CapsuleTech would be a high switching cost. UHHS with DCX has addressed all the problems that the hospital needed to address while improving patient and employee care. Recommendations: stay put with DCX. It's not necessary to transfer to other competitors, mainly because of cost.
We want to thank everyone in advance for their feedback, their questions. Thank you for tuning in, and the Concept crew really enjoyed connecting here with you guys and showing you guys the importance of information systems within the healthcare system.